Boom, boom, boom. All right. Freaky Friday. Welcome, folks. Thanks for joining in. Thank you for joining in. Dr. Dan here. Dr. Dan Whitelock here. For those of you who don't know me, I'm a cannabis physician. I certify patients in the great natural state of Arkansas for their medical cannabis dispensary card access. So that's what I do. I specialize in cannabis medicine. I like to unveil a lot of the hidden mysteries in this wonderful cannabis plant that we're now able to use in our state for medicinal therapy. So I wanted to thank you guys again for joining me on this Friday. We're getting it started pretty early. I have a little second before I start to roll things out and see patients, but I did want to touch on something regarding mental health. Okay, super important. I feel very, very deeply about this. For those of you that know me and have spoken to me before, and I don't think I really say a whole lot of it uh, on the subject to that effect when I do these vlogs, these live casts. I know of late I've been digging a whole lot into the structure and function of the endocannabinoid system a whole lot, and there's still a whole lot to break down and demystify in terms of what's going on with the endocannabinoid system. But I wanted to just take a brief sojourn from that and dig into some stuff regarding mental health because I come across this a great deal in this arena of cannabis medicine because as you know, guys, medicating with cannabis for a variety of mental health conditions has been shown to be beneficial. And I won't get into the literature cited exactly per se today, just for brevity's sake. But a lot of people have it's been a lot of people have self-medicated with cannabis for a long, long time for things from anxiety to insomnia, post-traumatic stress disorder, even in bipolar patients, formerly manic depressive bipolar patients, been shown to get good results in staving off that mania. Okay. We do like to exercise caution, though, with keeping an eye on depression. I like to keep a really good tab and take a good history as far as the mental health history and depression inventory. For those of you who are into the educational minutia of things, the PHQ-2 and 9 inventory, just to make sure things are hunky dory. I like to be a little bit more careful with the bipolar patients, but this subject of excuse me, dehydrated in the morning. Side note, guys, I like to do these podcasts ADD style. I like, it's my damn podcast, right? So if I want to veer off on my tangent, fully ADD style, I'm going to. So, mental health aside, taking this sip of water and hydration, super important in the summer, folks. Super important in the summer. Stay hydrated as well. Marijuana users, both recreational and medicinal, cottonmouth effect, not surprising at all. So, guys, make sure and stay hydrated. Very important. Keep that water running, because marijuana users tend to run a little dehydrated. Okay, even after you get that first sip of water in you, you want to keep it going. Okay, because we're underestimating our insensate losses. Okay, because especially when you smoke, what happens is you're drying out some of that surfactant a little bit when you take in any kind of smoke. So you want to be able to get that lung lining, okay, the lining of the inside of our lungs, All right. When I talk about that fluid, that surfactant, I'm just talking about smoke it out through the trachea and down that respiratory passage. So make sure and keep hydrated, as well, to keep your blood volume up, keep everything getting oxygen. At the end of the day, oxygen currency of our body. So you want to keep the volume naturally of our blood. We don't get too viscous, guys. Anyway, so hydration aside, yeah, guys, just good practice. Okay, good practice to always stay hydrated if using marijuana products, even the ingested via a sublingual route under the tongue or the edibles. Hydration, it still counts even if it's not being inhaled via combustible smoke, smoke, vaporized oil smoke. So getting back to the mental health, we'll dig into this a little bit more, guys. Because I keep seeing, I see an astounding number of PTSD submissions, right? So a lot of the ball game, from my standpoint, in making sure that someone is certifiable, is that it's actually post-traumatic, getting the diagnosis correct, and that it's post-traumatic stress disorder and not merely depression. Okay, let's just kind of break down the diagnoses a little bit, guys. Making sure someone actually has a certifiable diagnosis is what I do. All right, there's 18 qualifying conditions in the state of Arkansas. We'll go over those ad nauseum another time, or find a way to get it up on one of the videos, or probably post a link under my page. Again, guys, my website is armmjcards.com. That's where you go if you're in the state of Arkansas and you're looking to get your card real comprehensively done and get some cannabis knowledge while you're at it, how to use your medication effectively. Hit me up, armmjcards.com. You will speak to me. All right, cool, good deal. So mental health, getting back to that. Guys, I see an astounding number of PTSD submissions, and a lot of times I just want to explain to the patients, how PTSD differs in terms of diagnostic criteria versus other entities, like, say, bipolar in and of itself, or depression in and of itself. Depression, pretty straightforward. The symptoms of lethargy, the negative feelings, all of the other symptoms that go with just generalized slowing of emotions and blunting of emotions, and decreased drive for things that formerly would make one happy, activities that one would formerly engage in, they're no longer wanting to engage in, and they're not engaging with their friends and family as much anymore. So we have symptoms of depression. Okay, not certifiable in Arkansas. In other states, maybe. Other states have long permissive lists of qualifying conditions. Arkansas is not, the list is not as long. For example, when California was a medicinal marijuana only state, insomnia was a qualifying diagnosis. Now they're recreational, so that might not be as pertinent. They still do have a medical program, but we don't have insomnia or generalized anxiety disorder, right, on our qualifiable conditions list. Okay, so it leaves us with post-traumatic stress disorder. And the reason why I wanted to kind of bring up PTSD, because it's so pertinent, so important now. I didn't have an appreciation of it as much before when I was in general practice, because it wasn't, for whatever reason, it wasn't popping up as much. But now that cannabis is on the table as a therapy option, okay, people are coming out of the woodwork more, and I'm seeing them a lot more. And it's not so the question might come up, okay, doc, how do you differentiate, how do you know if someone is giving you a bowl of crap, okay, if they're just giving you a story, okay, versus are they telling you something that's actually valid? Okay, say someone presents with with a complaint saying, hey, I was molested as a teenager. I went on a date with somebody and I was molested, or some type of sexual assault, molested by a family member, sexual assault, something like that. Uh, how do you know? Okay, the question comes up, as a medical legal point, I guess. I made sure to cover with counsel first, so I'm covered on the terms and conditions. The short answer to that question is covered on terms and conditions, where patient signs often says that the basically the history that they're giving is true to the best of their knowledge, and that they're not doing this for secondary gain, only to use it for recreational purpose. They're doing it for a medicinal purpose, and what they're telling me is legally true. So, as for any diagnosis, right? For anything, people can come in for factitious reasons for to get insulin. So the same medical legal principles apply for medical marijuana that apply to any kind of therapy, because people can try and get their hands on pharmacopoeia, prescribed medications for illicit purposes. Even things that are non-addictive, they can be black marketed and resold. Believe me, there's a market for everything out there. So that's why that's on the terms and conditions. But more importantly, folks, with this mental health argument, is uh, is the actual clinical presentations that I'm seeing, and these things really, to just get down to it, is straight heartbreaking. All right. A lot of the stuff that you see, the reason why I insist so much on patients both giving me a written history so I can get a full history on all of my patients, both the history of their qualifying condition and the history behind other conditions that they might be managing. Okay, because that stuff's important. Family history is important. Their living situation is important. Past hospitalizations are important. Working status, relationship status, support system, all of that stuff is important. Believe it or not, their allergy history is important, right? All of that stuff, it all counts. If someone has hyperactive airway, right, for some reason, okay, that counts. Pertinent. All that stuff is pertinent. Someone is on lithium, okay, that is pertinent. Someone has had a hospitalization for psychosis. I want to know. Nosy, right? I'm nosy. I definitely take uh I definitely take some professional extension, you know, in terms of being able to be nosy, because it's for people's health. So I don't have a whole lot of room to mess around, because people don't play. They will sue you if you get it wrong. So I want to get it right. Okay, for patient safety. I love my patients. You guys are great. Little Rock, boom, big up. I wanted to big up Little Rock. Gotten a lot of love from Little Rock lately. I love you guys. You guys have been great. Little Rock, Conway, Jacksonville, Sherwood, the whole neighborhood out there. I forgot anyone. I'm sorry. I don't live in Little Rock. I passed through. Um, but yeah, I have my Little Rock location now, guys. Got my bubble on Google. Rate me on Google, guys. Let me hear it. If you like it, give me the thumbs up. If you don't like it, let everyone know. Not everyone, maybe everyone doesn't like me. Um, I unfortunately, there was one patient I couldn't approve because I felt like this person was a medical legal risk, and this patient, not patient, because I didn't take any money from him, wouldn't make him pay. So yeah, I went on the message boards, and I just me. So yeah, there's stuff online about me. I haven't taken it down. Let her say what she wanted to say. So yeah, but getting back to the issue of mental health, great segue, because she was nuts, cuckoo. Yeah, not a straight diagnosis for that one, but she was something. Um, Hopefully, well, everyone finds someone to. Needed a lot of love. Special case. Anyway, But getting more seriously speaking, getting to the issue of mental health and suburbanization, I wanted to touch on this really, really specifically in terms of the PTSD diagnosis. Okay, and people getting a handle on trauma, and really just knowing that more than anything, okay, um, it's okay to acknowledge that hurtful things happen in life that we don't have control over, right? And I'm definitely not the psychotherapist or psychiatrist, head shrink doctor like that, but I definitely like to throw it out there to people that whether you try cannabis as a viable therapy, um, getting the chance to at least acknowledge if you've gone through trauma, mental trauma, physical trauma, some sort of trauma. It doesn't have to be a single incident. It could be a protracted thing where you lived in an abusive household with an abusive parent or an abusive spouse that was physically abusive or verbally abusive. Someone telling you you are worthless. I don't love you. Right? I wish you were never around. Those are hurtful words that can scar you all the way to the middle of your heart. Okay, it can tug at the very fiber of your being, okay, and make you feel like you're this big, and you can remember that forever. All right, and make you feel angry, hurt, sad, make you feel guilty. Someone can, it can get into your head if they catch you at a vulnerable moment. All right, they can get into your head and wiggle away and screw their way. All right, get their claws into your vulnerable part because you might trust them, and they can make you believe something about yourself that they want you to believe. Okay, so I just wanted to touch on that. I want to touch on mental health a lot. I don't want to over belabor the point, but I don't think I can belabor it enough. Okay, people that have been uh, bullied, okay, people that have been ridiculed for things. I've come into contact with people with disorders like Tourette's disorder, all right, which is a spasmic movement disorder, which does qualify, all right, which does certify in the state of Arkansas, because it's a spasmic disorder. It's a muscle spasm. So those spasmic disorders that fall into that spectrum, if it's a neuroactive spastic disorder, certifies in Arkansas. So a lot of people see, the thing is, when you have one diagnosis, there's other things that can come with it. Okay. Social aspects of diagnoses can be super disabling. Okay. So I want to just inform the general public as well. See someone who makes a grimace, okay, or makes a noise or a tick, all right, those people are not fodder for you to just look and point and laugh and make fun of. All right. It's not cool. All right, guys. It's not cool. It's not awesome. Maybe, when you're kids, middle school, whatever, you say, hey, 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 look at them. If they do a grimace of Tourette syndrome and they bark, there's all sorts of things, and Tourette's is just one. Okay, if people have some conditions, medications can induce certain spastic like things that might look like that, where people make funny grimaces with their face. And I don't mean funny, but like they'll do moves with their face. It's called tardive dyskinesia. All right, for all you heads out there who are curious, I know nurses are out there listening. I certified me a bunch of nurses. It's open to everyone, guys. Okay, if people are curious about marijuana law, and I get into that because teachers as well, they have questions about like public school. What's going to happen? Are they going to test me? What happens if I have a card and I get tested? Short answer: right to work state. All right, Arkansas. They can fire you for having freckles. All right. Shout out to people with freckles. You don't deserve to be fired. Okay. Everybody has redheads and children. All right. There's nothing wrong with it. Nothing wrong with it. All right. Anyway, wear your sunscreen. Good deal. So, you know, it is summer. People with freckles more prone to these skin cancers. ADD conversation. As I digress, I just want to give you guys a quick nuggets. Mental health. The medical information. You want to get a whole lot of info. Your doctor needs to be giving you guys info. Whoever your doc is, right? Doctors, talk to the patients. All right. I'm finding a lot of doctors, some good doctors out there. I am finding that do talk to their patients, but up to you, ladies and gentlemen. Just talk to the patients a little bit more. Get a little more history. Patients, you want your doctor to ask a lot of questions, so make sure doc is getting history. Family history is important too. Yeah. So getting back to that, this issue of mental health, I really want to circle back to it, because I really just want to tardive dyskinesia, as I was saying, folks. If you take antipsychotic medications over time, what can happen is you'll get facial grimacing. You get like a little thing like this. Okay, and it just happens with some antipsychotic medications. And I say antipsychotic, but these are also anticonvulsants. Okay, so uh, you'll find that sometimes you can happen with these. As it happens, you'll get this tardive dyskinesia after using certain antipsychotic medications, and some of these antipsychotics I've come into contact with in practice. Okay, and some people who are on taking these anticonvulsants who also present with certifying conditions for medical marijuana. Okay, so the question is, what do you do? This is uncharted territory. This stuff wasn't in the textbooks. What do you do with cannabinoid therapy alongside other Western pharmacopoeia, right? These medications that I use in the family medicine clinic. What do you do? Can you dose the medication when they're taking lithium? If they're taking lamictal, if they're taking phenytoin, can you dose these people? Well, can these people dab? No, I don't like anyone dabbing. Too much, too much. Concentrated dose. Flood those receptors. Okay. So as I digress again, getting back to the post-traumatic stress disorder, if I could do live casts on this PTSD, alone, 4 or 5 of them, I'd love to do them. Because I really want to reach out to those people more than anything, because it's not just one diagnosis. There's PTSD from car accident, boat accident, something of accidental nature that happens once, people being witness to assault, murder, uh, pet assault, animal assault, animal cruelty, murder, um, people witnessing all kinds of beatings of parents, spousal beatings, all of this kind of stuff. All right, all kinds of stuff. Um, just people being on the wrong end of things, incarceration. All right, guys, let me tell you something. If there's one thing I have a pretty good handle on, it's urban. It's urban, uh, the urban nightmare. Okay, that's almost a PTSD diagnosis in and of itself. Okay, um, not necessarily only living in an urban area per se, but living in uh, disadvantaged socioeconomic status. Okay, SES is a huge thing. Okay, let's not beat around the bush, guys. All right, you live in America. There's more than one America. All right, I'm not trying to get political on this, but when you're talking about medicine and cannabis, and the when you mix politics and medicine, you get bad results. Okay, so politics and medicine is almost unavoidable for me. So I like to dip my toe in the water and then get out real quick before there's just a firestorm barrage of people. Okay, so I want to steer clear of that, but I do want to say that when you look at um, when you look at opportunities for intervention in medicine, and you compare disadvantaged socioeconomic status patients versus people who are in a more stable middle class status and up, okay, the results are stark and sobering, okay, and simply living in a disadvantaged environment portends a worse prognosis on everything: life expectancy, quality of life. Okay, so there's years of life lived, and then quality of life within those years. So not only is your life shortened, quality of life for that shortened life is less too. So you lose twice. You lose more than twice, but you lose at least twice. They're the two biggest ones. All right. Think about that just for a second, folks. Quality of life years. If you guys get sick of hearing that term from me, I'd be fine with it. Okay. Quality of life years. That's a one metric. Okay. Let's keep it simple, folks. That's the one metric when you're talking to your doctor. Okay. That's a one metric that you might want to just ask about, because that's really the only thing that a physician should be looking to give you. If they're not giving you that, you're not getting your money's worth. Quality of life years. All right. Quality adjusted life years. QALY, your quality adjusted life years. Okay. If someone comes to me for care, okay, whether it be medical cannabis or chronic care management, hypertension, diabetes, metabolic syndrome, things related to that, lifestyle related things that cause disease, whether they come to me for that or cannabis, really at the end of the day, for their cannabis certification. Really at the end of the day, if I can't give them quality of life and make the quality of their life better and increase, right? And if I can increase the time that they're on this earth, follow the sort of steps that I like to lay out. I want to give them a longer life and or a better life. Okay, that's really what I'm looking to do. And then I work backwards from there. Okay, what can I do? What can they do? And if I can do something that has high therapeutic benefit at low cost of collateral damage to the patient, and it's convenient to take, and they can stick with it, and they can have predictable dosing with it, and I can always have the same predictable effect, I'm going to want to use that thing. Boom, cannabis on cue, on target, right? Cannabis is perfect for that, because the safety part, all right, safety has been established, all right. We can go into the literature about that some other time, maybe on a blog when you guys can click it and read it for yourself. The safety has been established. um Not only that, apart from being, first, the drug has to be safe. Apart from that, it has to be effective, has to do what it purports to do. All right, it's supposed to perform a function. All right, not just do nothing. It's supposed to perform a function. All right, if it's making you feel good, if it's bringing down that level of anxiety, just like how the benzodiazepines were meant to do. All right, if it can bring your level of anxiety down about a traumatic event that you went through, then naturally that HPA axis, that cortisol axis, the adrenal axis that pumps out the adrenaline, when you start to feel fear regarding a memory of an event, okay, makes the heart start to beat, your adrenaline starts to pump. That's where cannabis comes in and exerts its neuromodulatory effect. Okay, it modulates your nervous system. It adjusts it. That modulation is adjusting it so that you go from the fight or flight state to a regular, cool cucumber, easy, relaxed state where you can at least acknowledge that a memory of something uncomfortable is there, but you don't need to react to it in an external manner, because maybe you might have a chance to slow things down, okay, and see that this was something that you were truly a victim of and you didn't have control over. So as time goes on and you're able to meditate on that sort of thing and realize the actual factual nature of the thing that happened rather than just having an emotional reaction to it because you're a victim, you might be able to find yourself to a better place where you actually get therapeutic benefit beyond just only feeling good for that moment. Okay. And very few medications, I can't really think of any medications that can do that safely, and cannabis has been shown to be able to do that safely. Okay, high therapeutic benefit, great therapeutic index. All right. I'd like to get into dosing because it does have to be dosed properly. If you go too crazy with it, it's not going to have the medicinal benefit. You're going to drown those receptors. I'll get into the CB1 and CB2 thing, and how important CBD is. CBD doesn't get near enough airtime. Doesn't get near enough airtime. But PTSD, folks, I do want to dig into the urban nature of it because I'm seeing a whole lot pour out from the disadvantaged socioeconomic status um, zip code. You know what I mean? Because there's a lot of stuff that happens there that maybe that doesn't hit a lot of just mainstream uh, media news, that sort of thing, and doesn't always hit my ears unless there's some reason for it. And it's never really a thing that, to be honest, I inquired about before in general practice, and now doing this. Um, there's things that occur just as a result of where you live and pressures that are unique to that patient population because and across different cultural groups, ethnic groups, there are things that are more centered certain ethnic groups, African American, Black population, the Latino population as well. They have things that are very unique to each that have to be taken into context. Okay, for example, I saw a Latin American gentleman. All right, grew up here in the States. Young guy, must have been in his 20s. Um, looked like he came, just from what I could glean, looked like he had a pretty rough upbringing. And from what he said on his form, he obviously had an abusive upbringing. Two parent alcoholic abusive, double, both of them. Uh, Physically abusive to this young man. Now one parent incarcerated. One parent has cleaned up their ways, and there's been some forgiving, but there's still resentment because of that, and harboring a lot of feelings from that. And then now in currently sort of in his circle, when he gets into I guess gets into certain discussions or maybe disagreements or whatever, um, he might get he'll get worked up and get so worked up that he'd get mad, and when he'd get mad, he'd cry. Okay, maybe not boohoo tears, but tears would come out of his face, because he has to hold it in. Really, he'd tell me really what he wants to do is go and throw fists. And when that has happened before in his former time, he'd get in trouble. And he didn't like getting in trouble because he was not a bad kid per se. He grew up in a rough environment and he knew how to take care of himself, but he didn't want to do that kind of stuff where he had to get in fights. He didn't like it. So what you have is, on the surface, a guy who looks well tough enough and hardened enough, but only doing that as a means to protect himself. And his friends or circle around him would make fun of him when they'd see him get upset and cry. But he's very emotional. Some people are very emotional. Some people are very emotional. Guy or girl, that crying doesn't mean that they're a sissy. It just means that they feel so deep. Their emotional memory is so deep that their scars make it that their experiences in early life are horrible. So when they experience displeasure from another human, they react in a way that's been imprinted on them like a fingerprint from young. All right. So how somebody reacts needs to be taken in context. So some people deserve a little bit more time and patience. So apart from understanding that this guy had a long series of trauma, he really needed someone to hear him out and understand how his situation was unique. You know what I mean? So, and truly heartbreaking, folks. When I've seen hundreds of these PTSD submissions, and getting back to the earlier discussion regarding, um, regarding whether or not these things are valid. Guys, you can make some of this stuff up. Okay, maybe on one of these, I'll make like a highlight of the kind of stuff that gets said to people and done to people, and it would shock you. Okay, it's absolutely shocking. I can't look at these sometimes. Sometimes it's just it'll eat out the inside of you, and it's not a thing that should be taken lightly. And I don't take it lightly when I take inventory with these patients. I always try and figure out whether or not they have a support system, a therapist they talk to, whether or not any other party, drugs, or alcohol is still going on, because I want to know, not because I want to put someone on the spot and judge them. I judge nobody. You know what I mean? From really, when it comes to how someone is, I judge nobody if they use crack cocaine, has snorted cocaine, has used methamphetamine, had an opiate addiction, has an active opiate addiction, has an alcohol problem, had an alcohol problem, went to jail, all of that kind of stuff. People have pasts. I don't care. Do not care. I do not care. I care about my patient. I don't give a crap about your past or what you've done that might be your dirty little secret. Okay. I don't care if you are a straight person, a gay person, a transgender person. I care about you as an individual person. I don't care to judge you about any sort of thing that you are doing. If I can keep you out of danger and keep you happy for longer, then I'll do that. Okay. Any patient presentation is fair game in my ball game. All right. Anything, all welcome. All right. Everybody. If you've been through trauma, you're curious, you don't know if you've certified, write it down. Check me out, armmjcards.com. All right. We have a free PTSD inventory that you take before you see me. I like to see the whole patient history. So you get to see sort of face to face for yourself whether or not you'd be a good candidate. If you slightly only went through a little something, there's not a whole lot going on. Sorry, can't help you. I wouldn't want to certify you guys. Don't bother waste your time if you don't have a PTSD diagnosis, guys. I'm not going to make you pay, but I'm also not going to sign on the dotted line. Okay, not interested in it. Don't care. There are other doctors. You can find them. They're out there, guys. I'm sure you can find them. They're probably out there. No names, but I'm not going to sign off on it. If you're looking for someone to check you off for recreational marijuana, don't want the money. Don't want it, guys. Okay. There are people out. I want to keep it only in the avenue of people that can benefit from medicinal marijuana. The party stuff, you can go hit your guy up on the corner. It's not hard to get black market marijuana. It's been around for 40, 50 years. So you can get it. This dispensary stuff is for, in this state right now, it's for medicinal marijuana. Once it goes recreational, which I'm sure at some point it will, then for everyone. So I try and keep my line of talk really for the medicinal cannabis, because that's what I do. Anyway, I want to dig into this PTSD stuff again at some other point, folks. Um, I really thank you guys for tuning in, thumbsing up, sharing my stuff. I went a little longer this time than I did before. Not really sure if people are bored watching these. I certainly get bored hearing myself talk, but this is essentially my therapy because, I'm locked down in COVID. My new normal is working from here, seeing patients from here, not in the clinic. Big up and big respect to all of my colleagues out there, frontliners. You guys are doing a great job. All right. You guys are doing the heavy lifting. I'm doing heavy. I know my patients are grateful for what I do, because I'm still taking care of stuff apart from the cannabis certification. I'm still taking care of a lot of my long-term patients that need to manage their type 2 diabetes and their hypertension and hyperlipidemia. Those sort of chronic care stuff. People that need upkeep with their thyroid medication, what have you. But really, at the same time, the hospitalists, the people who are taking care of people frontline and have to mask up and wear all the PPE, and they're still putting themselves in harm's way. You guys are doing a great job. Nurses as well. Unsung heroes, the saviors of all. My nurses, love you, ladies and gentlemen. You guys do such a great job. Respiratory techs, my medical assistants, nurses assistants, the CNAs. You guys are keeping this whole ship running together. Administrators, okay. There's so many people that make this healthcare thing run, and push this monster forward. So I really want to shout out to you guys. You guys do so much. So I can't really say enough. There's a lot of people that are doing so many things behind the scenes. You healthcare workers, not just the doctors. It's everyone out there who's really, really putting a lot of effort forward. So, love you guys. Yeah, apart from that, my patients, people, not just my patients, people listening out there, thirsty for cannabis knowledge and everything surrounding it. I really do thank you guys. I'm Dr. Whitelock, Dr. Dan, for those of you who know me. I really do thank you guys for tuning in and spreading a lot of cannabis medical knowledge. That's really what I'm about, first and foremost. Spreading of knowledge before all else. Before all else. If you guys want to tap my brain, I'm always happy to answer questions and give you guys really whatever you want to know as far as what I know regarding both cannabis knowledge, as far as medical therapeutics, as well as other things surrounding it to just increase our quality of life years and really get people to just live longer, happier, better. Happy Friday, guys. Love joining you guys. Great talking to you. Hope all is well. Be kind to your neighbor. Mask up. Those hands washed, folks. Social distance. All right. Keep it social distance, guys. We just got to stick this thing out. All right. I know it's inconvenient. I know it sucks. It sucks for everyone. Not just financially, but socially. Take care of your mental health, folks. Please just take care of your mental health. Talk to a loved one. Get outside. All right. Little Rock, y'all have shown some great love. Thanks for helping me get some good reviews. Let's get some good reviews on those Google My Business stuff, weed maps. Love you guys in Little Rock, Conway, Jacksonville. Messed up on that one. Yeah, man. Thanks again, Cabot, all you guys. Thanks again for tuning in. Dr. Dan out. Love you guys. Bye.